Welcome to Medical Insight, a weekly healthcare feature brought to you by the experts at Essentia Health. Here's your host, Anthony Matt.
Today on Medical Insight, we're talking about our genetic counseling program, a way to determine your genetic risk factors for certain diseases. Here's how it's helping women specifically. At Essentia Health, our genetic counselors work with patients to understand if they have a genetic risk for things like cancer and other diseases. For women, it can be used to determine the likelihood of breast cancer or ovarian and uterine cancer and more.
We meet with a lot of individuals and going through their family history and pursuing genetic testing to help create a personal screening plan or surveillance plan.
Genetic testing is a type of medical test that identifies changes in chromosomes or genes. The results of a genetic test can confirm or rule out a suspected genetic condition or help determine your risk of developing or passing on a genetic disorder. Genetic counseling can also guide you through genetic testing before or during pregnancy.
Other reasons relative to women's health might be to help those couples who are planning a family, if there's a inherited or genetic condition in their family, or if they have questions about what could be passed down to a child.
The process is fairly simple. Once you meet with one of our genetic counselors, they will ask you questions about your family's medical history and talk about potential genetic risk factors, and then conduct a DNA test. From there, they'll determine the best path forward for you.
This can also be information that can be available to people's family members and relatives as well. So genetic testing can both help you and your family learn information to make the best health decisions for yourself and your family.
To find out if genetic testing is right for you, meet with your primary care provider.
This Medical Insight was brought to you by Essentia Health. To learn more, go to essentiahealth.org.